Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. This channel is dedicated to amplifying the voices of doctors, other healthcare professionals, and patients as they share their unique struggles, triumphs, and passions. My mission is to build connection and create advocacy for healthy doctors, driving positive change that benefits both doctors and patients. This is a space for everyone who cares about the future of healthcare. If you appreciate this content, please like and subscribe now. It really helps the episodes reach our target audience. And today I would like to welcome Dr. Michelle-Linh Nguyen and Jenny Opalinski. Thanks for joining us today, Michelle and Jenny.
Thanks for the invitation, Kim, and all the work that you do.
You're very welcome, and I'm happy to have you both. And by way of a brief introduction, Dr. Michelle-Linh Nguyen is a primary care doctor who founded Canyon Oak to promote a sustainable and purposeful model of healthcare work. And Jenny Opalinski is a speech therapist who co-founded the Wellness Shift to support mental health and healthcare workers in the way we work and live. And today we'll invite you both to tell us about Canyon Oak and the Wellness Shift and how these initiatives support doctors and other healthcare workers. So I always ask, what would you most like our audience to know about you? And Michelle, would you like to go first?
Sure. So as you've heard, I'm a general internal medicine doctor, and I'm currently building a direct pay solo practice in the Sierra Nevada foothills of California. So right now I take care of healthcare professionals throughout California and then all comers locally. And I also had a past life as a healthcare kind of systems design researcher, where I led several research studies, mostly focused on how time scarcity and outdated time organization can kind of get in the way of doctors caring for their patients as well as caring for themselves. So looking back, I've been pretty interested in like physician well-being, workforce well-being for quite a long time. Um, I could go on. I mean, I think I'd like just to kind of give a personal snippet, I guess. I'd like the audience to know that, I've been through some fairly painful stuff. A painful divorce. And I think it really helped me realize like kind of how far I'd veered from myself and how like neglected my mind and body were back during that time. And I just really didn't realize it because I was so good at adapting. So I spent a lot of years really working hard to kind of get to know myself better and learned how to manage myself in like a more positive and healthy way. So that's been a big part of my journey over the last couple of years.
Well, thank you so much for sharing that. And I often say every time a doctor shares their story, another doctor feels less alone. And today marks the 3-year anniversary of my own doctor taking his life. So it's a difficult day for me. And I'm sorry for everything that you've been through. But I love that you found a way to move forward and that you're helping your colleagues. So thank you so much for all that you're doing. And I'm glad that you're doing okay too.
No, I'm doing great. I feel really good.
Okay.
Yeah.
That's good. And Jenny, what would you like us to know about you?
I'm going to play off of what Michelle said. I have been a medical speech therapist in LTACs, ICUs, we're working with very medically complex patients. And I think what you said, the kind of adapting to it, you don't realize how heavy this work can be. So when I stepped away to a more industry executive level job and did the bedside work per diem, that's when it really started to hit me. And I am the type of person that if I have an emotion, I like to turn it into an action. If I can fix something, I try to figure out how. So that is how the wellness shift started and grew. And it initially really just started from one day, my coming home and being very upset about a patient and kind of realizing like, hey, I have these emotions and I don't know what to do with them. And I called my partner and was like, I think we need to like write a book or a guide or something because people are struggling. They don't even know it. Like you don't know how to recognize it. And then what do you do with this? And that's how the wellness shift started.
I love that so much. And later today, Medicine Forward is starting their own podcast, and I'm going to be interviewing someone who was a social worker and she's now a healthcare leader, and she experienced some of the same thing, right? She was dealing with children who had been abused and a lot of things, and didn't realize how the secondary trauma was affecting her. And then she realized how she was showing up, like angry or lashing out at the people she loved, like all of those things. And then as a leader, she wasn't empathetic to the people she was leading because she's like, well, why don't you just get on with it? I did kind of thing. And so I think this work year, I'm really learning a lot about trauma informed care, trauma informed coaching, trauma informed therapy, and how it's so important for leaders to take care of themselves physically and emotionally and to be in a good place so then they have the space to care about the people they're leading. And it needs to go both directions with healthcare leaders, doctors, and patients. So I love having these conversations. And Michelle, would you like to tell us more about Canyon Oak?
Sure. So the most basic vision for Canyon Oak has been a network of people kind of supporting one another through exchange of shared resources and inspiration and wisdom. Um, so the name Canyon Oak came from my childhood neighborhood, but I also have always loved the imagery of just like these beautiful oak trees that kind of grow out of the side of a canyon. I think we've all kind of seen a similar image, but it just speaks to, I don't know, these examples of life kind of flourishing even in harsh environments. And then I have to kind of share that I've always envisioned that Canyon Oak would kind of function like a fungal network that exists like underground in old growth forests. So if you haven't heard of them, these networks kind of facilitate communication and resource sharing between trees. And they help saplings benefit from the older trees and like the resources from the older trees. And there's not really kind of like a central node, it's just kind of a vast underground network, which I found just like mind blowing when I learned about it. So I kind of envision something like that. And I have special interest in connecting and supporting and nurturing like independent doctors and practitioners, because we're kind of going extinct. And my nightmare is that we go extinct
Mm-hmm.
with all the consolidation in healthcare. And I feel like it just doesn't feel right, a future where doctors are beholden to financial and kind of outcome incentives of their employers rather than patients. So in my mind, I think it was like up to me for some reason to kind of like do something to make sure that that doesn't happen. And right now, Canyon Oak is kind of what sprouted out of that feeling. And it's in early form. I mean, over the last year, I've created a website, which I've imagined as like an online home for wisdom and inspiration. And I picture that anyone can kind of go on there when you're feeling a little off or lost or down and find little bits of inspiration and wisdom to kind of help keep you going. And I wanted it to kind of feel like a chocolate box, kind of like you go and you don't really know what to expect, and you can find kind of delightful and interesting things. We have a wisdom library that Kim has generously donated to. And we also have little collections that kind of try to foster awe and inspiration and independent thought. And yeah, I mean, right now I'm trying to focus on what the next phase is. Like I've been feeling a little bit like foggy about it, but I think I just need to give it time. One of my goals is to make it self-sustainable, like from a financial perspective, because right now I've been kind of funding it myself. And so my current plan is to continue nurturing kind of a Patreon community and potentially a kind of store that features kind of fun, inspiring creations by community members. And, I'm still working on it, but the Patreon community, I'm hoping will have different tiers for like learners and students and members, affiliates. And right now, the kind of perks of membership, I'm still building out, but for sure, I think it will involve, learners and students having access to mentorship, and then kind of a subset of like members or affiliates who are really interested in independent medicine and kind of having their own practice, being able to access, monthly, like holistic kind of meetings with me and like other kind of core people that I've been working with. Um, so I will say that I've been feeling a little foggy about, next steps, but I think that's just part of the process and part of what I've had to accept about like, not putting too much perfectionist pressure on yourself, like just letting things simmer and letting things kind of become clear. Not to say I have not felt a lot of anxiety about it, but I'm feeling good about, where it is now. And I think I just have to be patient about figuring out next steps. So that's where I am at.
I
Well, I
love
love all of that, and I want to give a shout out to Gabe, Dr. Gabe Charbonneau, and he's the reason that you and I connected.
Thanks.
And I just loved our conversation. And also, I love your analogies. I just like the way you think. You're an out of the box thinker, and I think all of that is beautiful. And I just shared an episode earlier this week featuring Dr. Amy Vertrees and Dr. Brian Cohen and their surgeons. And we were talking about, or maybe that's the one I shared before. I'm getting them mixed up because I also just shared another one where we were talking about physician-led practices, and that was with Bradley Block. Maybe I haven't published that one, and Ryan Molly. Because they're in the Orthodox group, Ryan and Brian,
Uh-huh.
and they're actually going to have a gathering, an entrepreneurs gathering this weekend.
Nice.
And they're talking about how they can make it sustainable, and that they're speaking mainly with orthopedic surgeons. But that episode that I recorded with Brad and Ryan was speaking to how patients and physicians benefit from physician-led practices, and they have
Mhm.
very different practices. Ryan has more of an individual one, and Brad is part of a very large ENT
Mm.
practice. So they were able to share different ways that they've been making that sustainable. So I love all of that. And also speaking to you being like foggy about what you're doing, it's funny because now for over 2 years, like I call myself an accidental entrepreneur because I didn't plan on doing any of this. And now I've got this stand up for doctors thing. And I feel like I just shared that we need to bridge like healthcare leaders, doctors, and patients and have human conversations and understand each other. So I myself am in the process of figuring out, what I'm building, what it's looking like. So I understand being in that like subliminal space, and it's very challenging. So thank you. It makes me feel less alone. So go
I
ahead,
just
Jenny.
wanted to say, Michelle, because I've looked over Kenyon Oak, and I think it's so nice that you bring in that like art aspect there because we are so medicine focused that sometimes it you forget all the other parts of you, and those are the things that make you human. And for me, in what I've been doing with my podcast and with the wellness shift, what I hear a lot from both sides is I just want people to see me, right?
Mm.
The patient and from the provider, the healthcare worker, like I'm still a human being. And
Mm.
we don't have the time. Like I read your research also, and I really do agree that time scarcity is an issue. We don't often take the time or have the time to be able to like sit and look at a person and a whole person. So having a space where you can appreciate other parts, but within your community, I think is so nice that you're nurturing that.
Thank you. Yeah, I've thought a lot about showing up as a whole person in this whole process.
Yeah.
So that resonates.
Yeah. I went
Thank you.
recently, yeah, I went to see an exhibit by Amy Sherrill, who is the artist who painted Michelle Obama's official.
Mm.
And so
Hmm.
she paints these incredible paintings, and her subjects are people of color. But she doesn't use blacks and browns on purpose. She uses grays, right?
Mm.
Because her hope, she says, is that you can look at these paintings and see past the color and see the humanity, right? And I thought
Mm.
that was like so beautiful. For us in medicine, like a lot of times you see a person in that hospital gown and you're looking past, or you should be looking past, right? Race, religion, politics, whatever it is, you're just seeing a person. And I think that's what we want. And like the reverse also, like behind that white coat, there's still that person. And I think it's that connection between the provider and the patient that makes this kind of work so fulfilling.
Mhm.
Well, that's beautifully said too. And I want to give a shout out. Jenny attended our first what do you call it, book signing in New Jersey with Dr.
Oh,
Let
sweet.
Kawam, and with our book White Coats Courageous Heart. So I loved meeting Jenny in person, and we're now working on book two. And three words just came to me yesterday, which was hearts, humanity, and hope. So we'll see what's happening, but we might call the next one, White Coats Human Hearts, and then the third one, White Coats Hopeful Hearts. Because I feel like we're bridging all of those things, just talking about heart and humanity and hope and sharing all of those things. So thank you. That was so beautifully said, Jenny. Would you like to share more about the wellness shift, what it is?
Yeah, actually, it started kind of as just a need for action, and it became an advocacy platform. And I started what I do for my other work is read through research and kind of synthesize it and put it out to the public. So I started looking through the research in regard to healthcare workers, physician suicide rates, nurses. I mean, the amount of violence there is, it's really disheartening. And then the prediction of a shortage of physicians, of nurses, of healthcare workers in general, and the lack of really appreciation, and then the mistrust, the moral kind of injury of it all. I didn't understand the gravity of it until I started looking through this research. So I started to post this, and then in doing that, I said, well, what can we do to really help people get through hard times, right? Because therapy is the long-term answer, but maybe that is not attainable for people for whatever reason. Stigma still exists, especially for healthcare workers to seek help, right? Maybe time limits. You have a family, you have a job. It is very hard to take a moment to care for yourself. Um, so we started looking through research and putting out research-based strategies that help people manage anxiety, that help people get through stressful moments. And then I said to my partner, Joanna, who is a licensed mental health counselor, I said, nobody in healthcare is going to do anything unless it's evidence-based. So we need to also explain, why would we tell you to do this? I don't want to close my eyes and think of five things I can see and think, or sorry, that doesn't make sense. Five things I can hear, and then whatever the strategy is. Like, tell me why I'm doing this and tell me what is happening in my brain that is making this work. And so we started putting that out there, and it turned out kind of, and Michelle, to your point, we didn't really know exactly where we were going. So I had a lot of other groups reach out to me. We're working with executives,
Mm.
doing in-services for them, parents. We ended up writing a children's book because people were telling us that these strategies would work for kids. And so it kind of just grew into this whole wellness movement. But our focus and our heart really lies with healthcare professionals. And my first kind of aim is to help support them. Yeah. And Humanity RX is our podcast, which I started with two colleagues, Jonathan and Tova. And that came about because we wanted to do something to show that human side of healthcare. So it is a collection of stories from healthcare professionals, from patients, from caregivers. They're about 20-minute long episodes, and people tell a story that has had a profound impact on them in their healthcare journey, and then give a life lesson. So a lot of people have commented that that has been very healing for them, and they have enjoyed listening. So we're hoping to expand on that too.
Oh, I need to put some episodes on Canyon Oak. That sounds
We can
perfect.
definitely discuss. We were very, very lucky in our first season. We have some incredible guests that really shared some stories that I mean, they're amazing. People really are truly incredible in this field. The
Mhm.
amount of dedication and hard work and just their whole heart that they put into it, it's inspiring to see.
That's my magic word.
Yeah, I love that. I see that every day with with the doctors when I talk to doctors and they just fill my whole heart. Yeah, and I think they need, and actually so someone else, and that's why I feel like part of the, stand up for doctors, I have to find a way on a website. I wish I wasn't so technology challenged. I'm going to need help. Is that I could be sharing all that all of you are doing, to kind of make
Mm,
those connections, because everybody's doing their own thing, but I'm more one to amplify, what everyone else is doing. So I just have to figure out the best way to do that because another beautiful story, Pamela Marie Hobby, her and Betsy Gall and I collaborated on a Kevin MD article and we did a podcast. And she had childhood leukemia and she started My Doctor's Meds again. She wanted the healthcare workers to feel the gratitude from patients. So she's going to be starting a documentary series and she shared a little clip with me where she's meeting the oncologist that saved her life. Now he's 93 and she probably hadn't seen him since she was a child. And just to have that reunion. And she says, or she told me that she said to the wife, or, oh, I bet you get this all the time, just the gratitude and the thanks. And she's like, never. And she was
mm.
saying that it was also healing for her, for the spouse. So I think there's so many opportunities to do this, to share our stories and to show the humanity of each other so we all understand, where each other is coming from.
I do think
Michelle,
we
does that
need to.
go
I'm
ahead,
sorry.
Jenny?
There are also stories, from the other side that do promote the mistrust. And there are, not everybody is good. So I think that there is not very much of a focus on this, on this side, on the side that says, hey, I took care of you 10 years ago and I still think about you and wonder if you're okay. Like that very human side.
Mhm. Does that bring anything to mind for you, Michelle?
I think I was just sitting with it. I found myself thinking about we had supported my mother-in-law through a long journey through lymphoma treatment recently, and she's doing well. Um, but yeah, I remember, I was kind of her like advocate kind of during that time, and she was always so intimidated to like say thank you to her hematologist. And part of it, I think, was just there's a city country kind of like dynamic. And then also just you don't want to kind of take their time for too long. But I think that's what I was thinking about. Like, what are the dynamics that hold people back from being able to express these thoughts that they have, whether it's kind of feeling a little intimidated or whether, this feeling that you don't want to take the doctor's time for much longer or and then the other side, like thinking of me as a doctor and thinking of, her hematologist, just, you know, having certain professional standards to stick to, not getting too personal, probably wanting to get a little more personal, but then guarding yourself because things are just, things are complex and, things could go wrong and that's hurtful for you too. So really that in that 2 seconds, I was sitting with that whole experience and just yeah, wondering about those dynamics and how we might open up that space, to facilitate more like expression of gratitude or just a connection um, that I don't know, as Jenny says, like I think that's what feeds us, that little mini connection, feeling seen, feeling that our work is like, all the work that the hematologist team put in, that's seen. Um, yeah.
I think also like stepping into a situation and understanding that you're talking to another person allows you to give them a little bit of grace, right? In whatever respect that is needed. Like not every healthcare provider is going to have every answer. You know, a patient might be having the worst day of their lives and they might be a little short with you, but that's a very human thing.
Mm-hmm. Yeah, absolutely. And that sharing, thank you. That's what I want to amplify. And we had a big movement to thank doctors for Doctors Day, which was March 30th. But of course, any time is a good time to thank a doctor. And I shared with some people because we have a team that ended up evolving that helped push this, that sending thank yous to Doctor for Doctors Day. And our next meeting is going to be later in September. And I did spotlight to them since we won't be meeting before that September 17th coming up is National Physician Suicide Awareness Day. And it's horrible that there needs to be such a day, that over $400 in doctors, supposedly those are outdated statistics, are taking their life every year. And we have to change that. And just a thank you can mean so much. And I'm trying to think of a short, I don't know if it should be thank a doc. So if you guys want to think about it or anyone listening, because our book editor shared she was part of a hospital system once and they all wore buttons that said ask me anything or something like that, so everybody knew, like patients, that really you could ask them
Mm,
anything. So I
mhm.
feel like we need some little slogan, something, I don't know if there's something better than like thank a doc or something like that, that just gets that message out. And also for Doctors Day I was saying, and that means you too, doctors, because sometimes ER doctors feel like they're not making a difference and they only hear when things go wrong. Like their colleagues don't often say, "Hey, thank you for catching that or this," and not just ER doctors.
I also think from the other side, like doctors and providers, and they don't always get to hear thank you from their patients because their patients might move on, or especially in a hospital system, when it's more acute. So I was toying with this idea too, but Kim, go ahead and take it if you'd like. I was wanting to put together just a collection of people who had really appreciated their healthcare experience from the patient perspective, talking to their doctors. I feel like from a provider standpoint, hearing that, like that's really rewarding to hear that, to know that. When a family member sends you a card after their loved one left the unit, thanking you for the care that you provided, like that's why you do it.
Yeah, well, we can go ahead and we can amplify each other, or I'll amplify your work, and
A collaboration.
however that works. And that's what Pamela Marie Hobby is doing with my doctor's meds is along the same lines. And doctors have said a simple thank you can change the trajectory of their entire day, and that they have a drawer of thank you notes or gifts that patients have given them, and that helps them move forward through the challenging times. Um,
That's why you do it.
yeah. So
It's a
Michelle, was
profession
there?
of service. I'm sorry.
Right. No, that's okay. Is there anything else that's coming to mind for you, Michelle, or that you'd like to share that you want
Well,
the audience to know?
I think I am similar to what we've been talking about. I've been thinking about, really being seen, right? Like I think that sometimes in larger health systems, there are like appreciation days and nursing appreciation days, doctor appreciation days, but oftentimes it feels so generic or something that it doesn't really hit as much as maybe we would want it to. And so I think in any human interaction, just being specific about what you notice about what someone's doing, like can really make them feel seen and make them feel truly appreciated in any iteration of that, like doctor to doctor, patient to doctor, doctor to patient. Um, so that's all that I was thinking about in relation to that conversation.
Hmm. I'd say I love that, and then do it in any way that's comfortable for you. So if it's a colleague and you have their number and you just want to text them, if that's what's fastest and easiest for you, do that. If it's sending an email, if it's sending a note, because sometimes I think handwritten notes are very special, and I do that, with my own doctors. And sometimes that could either feel too time consuming or like it puts the bar a little higher if you feel like you have to know exactly what to write. So sometimes if it's like a text or an email, so sometimes those might feel a little bit less daunting, or verbally, just any being specific and any way that's comfortable for you, just doing it. If you're thinking of somebody, just let them know. And, if they did something that positively impacted your life, whether patient, doctor, colleague, healthcare leader, just let's spread thank yous and kindness and positivity.
Love it.
So, Michelle, how can our listeners get in touch with you?
Um, so obviously feel free to email me. I think that will be listed in the notes, but it's just michellelyn.md@gmail.com. You can also message me or find me on my Substack, which is mtln.substack.com. Um, and yeah, I would just say hopefully visit canyon-oak.org and let me know if anything resonates or if you want to add anything to it. I'm here. So open
Okay.
to any communication and ideas.
Well, thank you. That's terrific. And Jenny, how can our listeners get in touch with you?
I will leave my email in the notes, but the probably the best way to connect with me is on LinkedIn, Jenny
Mhm.
Opalinski, and the Wellness Shift and Humanity RX are both on LinkedIn and Instagram, and the podcast is available on all platforms.
Okay. All right. Well, that's fantastic. So thank you very much for having this conversation. I think it'll really be helpful to many people to hear it and just give a little boost where it's
Thanks for
needed.
having us.
You're
Thank you,
very
Kim.
welcome. So, in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So, stand up, doctors, and let's stand up for doctors.